Okay, so here we go. I wanted to continue the Two of Kind, a special journey. Um, is a vlog slash book that I've been, excuse me, that I've been writing for a couple years now, and it's about myself and my son. Obviously, I had to revise it. So this part is what Jacob has taught me. So, where do I begin? There are so many things. I'll probably have to do sections or different videos just to try to cover all that he has taught me. But for the most part, when he was born as a first-time mom, I learned patience. I was never a very patient person. I always wanted everything right here, right now, and because of that, I got into a good bit of trouble. However, I did learn to be patient because I had no choice. I was a first-time mom, and I wasn't just a first-time mom to a normal child. Jacob was extraordinary and very rare. Jacob had the MECP2 deletion. And that is a form of Rett syndrome. If you know anything about Rett syndrome, there is 1 in 10,000 women or girls that have Rett syndrome. The males, for the most part, with older research, had shown that the males usually die right after birth. Those statistics or numbers are changing rapidly because they're finding more and more males. Okay, so in patients, first of all, when he would nurse, it ended up being a bit of a joke because my sisters were like, "Where is Esty?" I was nursing him all the time. That boy would nurse nonstop. For a couple weeks, I called him my vacuum. No kidding. Like, he didn't even have a name yet. He was born at home. If I hadn't I mentioned that in the other video, but anyway. So, he was born at home, and everything was perfectly fine. I know I'm touching on a little bit of what you've already heard before, but there are new people on here. So, anyway, so he was born at home, and everything was perfectly fine until we started noticing at 6 months old. He wasn't rolling over. He wasn't trying to push up on 2 arms, the prone position. If you're a physical therapist, you know what that is. Or occupational therapist. But anyway, so he wasn't rolling over. He wasn't pushing up. He wasn't crawling. He was not doing any of that. And so right around there, we had him looked at by an orthopedic doctor, and sure enough, obviously he needed therapy. So that's when we started. He was 6 months old. And we didn't get a diagnosis until he was probably about 10 years old. And talk about patience. Oh my word. He couldn't open, like, one of his hands was clenched all the time. So the occupational therapist taught me that if you put your thumb right here and, okay, it's kind of hard to teach this when I've done it so many times myself. But anyway, you put your thumb right here and you put a little bit of pressure, and you cannot keep that from opening your hand. And so that would open his hand. Because it was constantly clenched all the time, and if you tried putting anything in his hand, you wouldn't be able to. You'd have to pry his hand open. Whereas his other hand, his other extremity on the other side of his body, was completely the opposite. His right side was floppy. He had no tone on the right side. He was rigid and spastic on the left side, but on the right side of his body, he was completely the other way around. So that was very difficult to work with. And then a couple years down the road, he became completely opposite, where he was so rigid and so spastic, it took 3 people to pry his legs open just to change his diaper. And that has its own stories. I won't get into that. Anyway, and so, you know, that took a lot of patience. He couldn't, obviously brush his teeth. He couldn't get dressed. He couldn't sit up. He couldn't, he was nonverbal, you know, obviously. And so, that in itself, took a lot of patience, because when you have a baby, you learn after some time what those cries mean. I am hungry. I am tired. I have a dirty diaper. You know, those kind of things when they're a baby. But when they get to be older and they're nonverbal, we're still looking at 10 to 15 years old. He can't talk. So, and at that time, obviously, we weren't really knowing what communicational device or ways of getting him to communicate with us. So it was very trying, because there were times I did know, because I knew his cries, but then there were other times I was not like 100% sure, you know? And so that took a lot of patience, because I got frustrated. You know, if he would lay there and he'd cry, and I would be like, okay, I want to relieve whatever is bothering him, but I can't, because I don't know what is bothering him. And that in itself was very stressful. I can tell you, there were days I wanted to pull my hair out. I mean, not that I'd pull my hair out, but I would cry. And he'd look at me, and he gets so frustrated. But he'd look at me like, well, it's okay, Mom. You know, he's like, it's all right. You know, in his own way, it was like, it's okay, Mom. We'll figure this out. How many times I ended up taking him to the hospital, to the ER, because, I mean, he would be screaming, you guys, screaming bloody murder in excruciating pain, and I had no idea what was going on. Sometimes he had a fever, sometimes he didn't, and it was a nightmare. And how many times I went to the ER and they really did not help me, because they had no idea. I'm not saying, you know, it was a bad thing to go to the ER or anything. It's just, a lot of the time, I would be sent home with, okay, well, give him Tylenol. I was like, I could have done that at home, and saved myself the trip and the hassle, because you're not talking about just taking a child to the hospital. We're talking about putting a child who's extremely rigid into a wheelchair, and you have to buckle him all up, and you have to make sure he's sitting right, and you have to put a head rest piece that comes down over his chest, because his head was floppy and he would fall out of the chair if you didn't do it right. And talking about getting him down the ramp, and notification, and get him into the van, and buckle down the wheelchair into the van. And that's one thing if you're doing all that by, with just one child. Here I had another child who was 2 years old, who had just started walking, and I had her on my hip, and here I'm trying to do this wheelchair, and I had to get her in the car seat and buckle her, and then I had to get him in his wheelchair into the car and like have to level his chair just right up, you know, in the van, because we're not talking about one of those newer vans that they have, you guys, with all the nice space. No, we're talking about a van that, you know, it only has so much room. So you had to maneuver it and maneuver it again and maneuver it again. And we're going through all this and the child is having an emergency, okay? And so you get, let's say, to the hospital. You have to do all of that in reverse, okay? All I know is, I forget the name of it. I don't remember the name of it, but there's some kind of awesome little carrier I found for my daughter, and that was, oh my word, you guys, that was a lifesaver. I could get her and I could either wear her on my front or my back, and I'd put her in that, and then I could maneuver the chair and unbuckle the chair and get him out and go through the hospital, and oh my goodness. But before I found that carrier, here I was walking around with the wheelchair, trying not to roll over, my daughter who was walking next to me. I mean, like, because she was like, you know, she wanted to try to walk ahead, and I'm like, no, I'm trying not to roll over you with your brother's wheelchair. And, you know, it was crazy. It was crazy. I look back and I think to myself, how in the world did I do that? But I did it because I had no choice. And then having patience for other people who were like, oh, could you fill this out? And, you know, and paperwork, and just patience for some people that don't know how to do their jobs right. Anyway, so, you know, you finally get in there and they start doing all these tests and poking and prodding, and the poor little boy, you're not making him more comfortable, you're making him worse. So after a while, you know, you just decide to yourself, I'm not going to go to take him to the ER unless he seriously has a temperature that's out of complete control or something, because you just oh, okay. Anyway, so it took a lot of patience, and I learned a lot of patience. In fact, my dad, I remember him saying, I have the patience of Job. My own dad said that about me. And so that was one thing that he had taught me is patience. But he also taught me to appreciate the simple things. You know, we take for granted on a daily basis, you guys. You take for granted. You don't even know you're taking it for granted. And I'm not pointing any fingers. I don't want to make you feel bad. But it's true that you take for granted the fact that you can eat. Do you know how many muscles you use on a daily basis to chew your food? The muscles, what it takes to take the you know, your spoon, number one, holding it in your hand right, digging down and scooping it up, all of those motions, what it takes. And we take it for granted because he couldn't do that. And it taught me a lot. It taught me what it takes. I don't remember all the numbers or anything. But anyway, well, I'm running out of some time. I love talking, obviously, as you can tell. So in the next video, we will talk about more on the subject of what Jacob has taught me. So hopefully you enjoyed this. If you did, do subscribe and like this video, and click, obviously, the bell if you want to be notified when I go put up another video. Okay? Bye.